And last up from our year one awardee presentations, we have Dr. Soojung Kim from the University of North Dakota.
Well, hello, everyone. My name is Soojung Kim. I have the honor of serving as the Dean of the School of Graduate Studies at the University of North Dakota. Throughout my faculty career in the communication department at UND, I've been very fortunate to be involved with this exciting project on radon interventions throughout my faculty career. So just put it into a context and then share what we have done so far. Like similar to the previous presenter, I really can't share the outcomes or the evaluations yet, but we'll share what we were hoping to do and where we are at in terms of the progress. Where did I put? Okay, here. So I won't read off this because those are some of the facts you probably are very well aware. Just put this project into a context. So I would mention a few things that there is a group of researchers at UND has been very passionate about promoting this radon and radon testing because of how high the levels across the state. And then there have been a lot of angles, I would say, in a different way to address those behaviors. As a social scientist and a communication person, my goal has been always on how to increase that awareness and communication issue. So ultimately, we get people to test their houses, changing their behaviors. We've done a few studies with those apps. We developed the app about 7-8 years ago when I was a junior faculty at UND, and that's really started this whole line of research throughout the years as a faculty. One thing that we ran into throughout those years of study is that the app that we developed has been a very successful tool to having people to understand the risks of radon, how important it is, how severe it is, especially to North Dakotans. And but then like they have to actually test their house to move into the next steps. What we learned through this app-related clinical trials is that although it's such an effective tool to give them the knowledge that they need to do and even order the test kit so that it's delivered to their house before they use it, app was found to be very successful in multiple trials. What we ran into, though, is that the app itself is not really helpful in getting them use the test kit that they received, so the testing behavior itself. And we were then trying to address that big question: what would be our way to have them test their house, like actual behaviors? Couple different ways to look at it is kind of using more those digital tools and then reminding people to use it. The other way to look at it, and this project is within that context, where who should we then prioritize? Who would have higher likelihood of actually using the test kits? So we landed onto this specific group of population, mothers of young children, and they would have not likely, but then they are more likely than perhaps college students own a home, and then they're relatively younger in a reproductive age to have a younger children, and they would come to the clinics for their well child checkups in a regular schedule. And what if we incorporate that clinical connection into this initiative and then encourage them to use it as somewhat part of their well child checkup, because they represent a highly motivated individuals who would care about their children and their household health. So the purpose of this study was to continue to use the Radon app that we developed throughout multiple other external grant opportunities to see if whether this app use and the promising effects of the app is working in this clinical setting, in this very different population of people who might actually be more receptive to this types of interventions. So the first aim was to test among those mothers of young children that whether using the app and receiving the test kit ultimately enhance their knowledge and other psychological behaviors and sharing of this information behaviors, which we, based on our multiple clinical trials, we were pretty confident because we've seen the positive impacts of the Radon app throughout other contexts. And then the second aim is actually the key aim that we would love to see whether that makes any change. Literatures say that overall test utilization rate, so once you have it, how often or how high likelihood of people using it is at around 20%. So those who receive a test kit, 10 out of 2 only uses it, 8 are wasted. So we were wondering this particular group of population and then use of this app and then use of the clinical connection, will that test utilization rate would increase more than at least 20%. So those are two of our aims here. So we partnered up with the UND family medicine clinics, both in Bismarck and Minot. And then kind of pointing to the mothers, we don't want to be any discriminatory or by any means, but evidence suggests that it's over 90% of the well-child visits are accompanied by mothers or mother figures or female guardians. So that's why we kind of pointed out as the mothers of the young children, and up to 4 years or younger. And then and they represent that kind of highly motivated group of individuals. So we have 3 different time points where T1, the first one is where the parents come to the clinic for their well-child checkup. And that's where nurses invite them about this study. Would you be interested in participating? They would do the pre-assessment on their base level knowledge about radon, their housing status and everything. They are encouraged to use the app. Very simple. You go to the App Store, download the app, and then they are given a free test kit at that appointment. And then after about 2 months later of that time point, we send out follow-up survey so that we can measure whether there was any difference in knowledge level or sharing behaviors. And throughout that month, if they selected to or elected to use a test kit that we provided at T1, we would get a notification from the lab that they actually used it, and if so, what was the level of the radon in their house. So that actual behavioral data would come at any time, but then we set this whole study period as a 4 months time period, so 2 months between each time point. So then cognitive outcomes that are measured by the survey would be measured in the second time period, so 2 months after the initial appointment, and the behavioral outcomes would be the actual behaviors, what is the percentage of utilization rates. So I'm gonna have our awesome graduate student who's been leading this clinical trial effort to share what we have done so far of the details of this trial.
Thank you, Dr. Kim. My name is Sydney Ray, and as she mentioned, I'm the graduate research assistant assisting with this project. So very exciting. We've been working to implement and get ready for this study for quite a while, but as of April 9th, specifically, of this year, myself and undergrad research assistant Kessa, who's in the audience, traveled to Minot and Bismarck to both the UND Center for Family Medicine clinics to actually implement our trial and begin recruitment. So with that, that meant that we were bringing our test kits to both locations. So that bottom image is actually what we call our swag bags, and that contains a single-use charcoal radon test kit, and then also like a few little swag items, chapstick, a hot, cold pack, all those good things. So the premise is that when a nurse brings a eligible participant, a mother of that young child, back to their exam room, they would present to them this study opportunity. There was a predefined script that we worked on so that we can try to keep it as consistent as possible, so that if there's variation in nurse presenting the study, that it's as consistent as possible across the board. So we brought these around 50 to each location of the clinics, with our goal to reach around 100 enrollments is our ultimate goal between the two. And as of right now, we have a little bit more as the 8th, the slides were due, so we're a little above 17 enrollments. So we're seeing them trickle in, and we're excited to see the data. The first 2-month follow-up email is set to go out in early June, so we're excited to see maybe some knowledge change at that point too. But yeah, it's officially implemented, and we're excited to see the data come in. And I think passing it back to anticipated results.
So hopefully, as we mentioned, that we would love to see that the app was still found to be very effective in this population in the clinical setting. I should also note that we've never really done this types of initiatives with the clinical partner. We've done it in the communities, but not in the clinic setting. So this is one of our new adventures too. So we are hoping to be able to replicate the findings that we've seen in terms of the effectiveness of the app in those particular contexts. And then at least that 20% mark of the test utilization rate would go up, given based on our evidence-based assumption that these mothers care about the health of their child and home, and highly motivated individuals to change their behaviors. And it would really demonstrate the feasibility of the app that we've been testing in different contexts and different clinical trials, and then expand an opportunity to continue this radon intervention initiatives in a different populations. Okay. So the conclusion is that it's with the funding delay, we are kind of slower than we anticipated, but slowly but surely we're making a progress. And then some of the key exciting things is that we've been able to measure those actual behavioral changes instead of any self-reported data. So that will give us a really good idea how this new adventure of venturing into the clinical setting and a new population would give us an idea and where the next steps to increase the testing rates, because that's been really the biggest problem. Okay, these are references, and then thank you for the TRANSCEND team, and then our RAs, and then Center for Medicine, and our partners across this initiatives. Thank you. Yes.
So I bought a now this carbon did, I think it's cost much less.
Right. Mm-hmm.
The app that you wrote, is that false?
No, app is really a facilitator. So likely what you bought is the digital test kit that it has the little window that shows the results numbers. The charcoal one doesn't have that. So the participants have to put it in their house, put it in a addressed envelope, send it to the lab. Lab would analyze it, and that's where we get the report, kind of confirming that they used the test kit. So the app doesn't really show the result or anything. The functionality of the app is mostly educational, and it connects the information about radon, and it does have that ordering ability, because we tie it to our other clinical trials where we were testing the ordering behavior of utilizing test kits. So that's as far as it has. But then next steps were kind of thinking that it would include kind of mitigation steps afterwards, because that part is really after the testing and after you see the results. What do we do? Those are usually the typical final steps, but that's outside of the scope of this trial. Thank you.
So one that has sold a home product, I know how much mitigation systems cost. They're not cheap.
No.
And so what types of resources then do you supply people that have high amounts of radon in their homes.
Yeah, well, thank you for that question. I wish I have some resources. As far as I know, the state does not provide any assistance. I went to North Dakota Public Health Conference a few weeks ago, and then I ran into some few folks from the agencies in the emergency management in the state agencies. And they were saying that now the emergency management took over the radon testing related support, not the public health side of it. So we chatted briefly about the needs of that state support. Doesn't mean that it's something out of it from the state, but we've been very proud to be a partner with other organizations throughout the legislative sessions where at least North Dakota now requires to disclose the radon levels if you have tested, which we had nothing. And that was a really difficult point to get them aware of what this radon is about. I think we're making a baby steps into the right direction. So at a certain point, it would be required, state would facilitate the mitigation efforts too. Thank you. Yes.
$200. That's great. But I'm pretty aware of not, and they're worried about not being able to do that much.
Oh,
Get it. Start something in.
okay. Mhm.
Yeah, Dr. Combs sent out an email about the PPR's office and neglected one-page white paper to do tomorrow.
Due in like a week or due tomorrow.
Yeah, so that's a really good idea.
Okay, thank you. Well, currently I don't have research expectation in my current role, but I'm hoping to continue. I think I've seen it from some of the colleges sent out that call at UND, but that's good to know. Let me connect with some other people who might be interested in pursuing that. Thank you. Yeah.
Are you sent back the data to the participants as to what are you also sending them something about whether they should be worried or not?
Yeah, so the lab sends that to them, but then I am BCC'd so that I get the notification that this individual actually tested their house in the level. So it's a PDF file where it shows the level, and it has actually some information from that PDF file where if you see level this higher than this level, you should be concerned. What's the next steps? But it's very information heavy PDF files. So that's another barrier that, yes, I tested the house. Yes, I got the results. Then they should be able to interpret that number and what it means to me in my house and then take the next step. So it's a lot of multiple behaviors in a chain to help people aware of it up to mitigating their house.
So at your IRP, they ask you about having some sort of, I don't know, counseling or something in the event that somebody has a very high level and gets really upset about the fact that their children are in an environment that's really high?
Didn't really get that, but that's a reasonable concern. I feel like, yeah, right. But we do occasionally get emails from participants, not this trial, but in other trials that they just ask for counseling that, okay, I got this super high number. What's my next steps? Then I usually send a link to the state environmental quality website where they list the certified contractors. But still, it's really burden is on them to figure out what do I do? How can I find the resources to actually fix my house? So still a long way to go. Yes.
Thank you so much. A wonderful presentation and research, very inspiring. And my question is a little bit outside the scope of our particular study, but I just wanted to share that I see a lot of potential for the finding for use and advocating for intervention at state level, but also working with the developers for fair housing coalition to really take an upstream approach where perhaps making the developers, fair housing specialists aware of the radon, and then also making it perhaps a requirement to meet certain levels, perhaps, because some of your participants might be living in apartments, for example, where they may don't have the kind of flexibility or options to get a mitigation system themselves.
Yeah, that's a great point. We do often get like a renters. They might not live in an apartment housing, but then they rent a house and live there. And they often ask, am I allowed to test it? I'm a renter. I got this high level, what do I do? Say to my landlord. So it's a multiple layered barriers to actually have people reside in a safe housing environment. But I do agree, it's a level of policy related work, evidence-based clinical trial, continue to advocate for the change at the policy level should really be the direction that we have to take. Yes.
Is there some like a app available where the radon activity of the state is available?
Oh, I don't have access to it, but I don't think that would be too difficult because this lab is one of the few providers of the radon testing. So they do share aggregated data. I've seen a few literatures that is a state of Pennsylvania somewhere that they got this aggregated results from this particular lab from all the houses tested in Pennsylvania, and they mapped it out with like a GIS approach. So I don't have it, but I'm not sure whether
It does exist.
it does. Okay.
In the late 1980s, the CDC partnered with the state of North Dakota where they measured radon levels in, I think, 3,120 homes. And those data had previously been available on the net. And then when I drew attention to them, the state got so embarrassed they took them down. However, you can get access to it using web crawler, Wayback Machine. The website is on our paper on radon physician's knowledge of radon in North Dakota. Also, those data show that every county in North Dakota is above the level recommended for remediation. The reason that I think the work that you've been working on radon knowledge is so important is that it's a situation where knowledge makes all the difference. Nobody tells you, for example, how to invest so you can retire. But everybody's going to retire. Some people are going to retire very well. Some people less so. It is true that up till last year, there were no laws requiring radon disclosure at the time of home sales, and we've changed them. But there are a number of things that an informed person can do to reduce her or his and their family's risk of radon, short of paying the big dollar amount to remediate your home. So I think part of the next step in radon education is, holy smokes, or not smokes because it's invisible, but holy whatever, my radon level is 5 times what it should be. I'm living in an apartment or I don't have $2,500 to fix it. What can I do? There are things that you can do and there's steps that you can take. And I think that part of the next step in the next evolution of radon education will be, oh, here are things that you can do.
Yeah, absolutely. Okay. Thank you so much.